Okay, future nurses, I'll be talking about the very obvious question, what is ethics? Since you're having this class, of course, we need to answer what is this subject all about and what do we mean by ethics? So when we talk about ethics, there's actually a lot of definition about ethics. Okay, different authors would define ethics differently, but one common definition is that ethics is a generic term for understanding and examining the moral life of a person. Let's look at the keyword understanding and examining the moral life of a person. This definition actually is from Dr. Letty Kwan. I don't know if you've heard of Dr. Letty Kwan. She has a model in your theoretical foundations of nursing. I think you've discussed her model about retirement in your theoretical foundations of nursing. Okay, so this is the definition from the book of Letty Kwan, talks about ethics as a generic term for understanding and examining the moral life of a person. In other words, our focus in the study of ethics is what we refer to as morality. Okay? We are inclined on the study of morality's effect on conduct. Okay, we are inclined on the study of morality's effect on conduct. Now, what do we mean by that? As individuals, we have our respective priorities and we have our respective morals in life. For example, okay, there is an individual who would prioritize money all over other things. There are individuals who would prioritize safety all over other things. There are individuals who would prioritize travel all over other things. Di ba? Have you met those people na kahit wala akong pera, importante, I can travel around the world? Have you met those people like that? Di ba? They will say it like that. Whereas others would say, kahit yung bahay ko simple lang, kahit wala akong sasakyan, it's okay as long as I have 1 million on the back. There are also people who would say like that. So in ethics, we are looking into examining the effect of this morality on the conduct of that individual. At the end of the day, for example, if you would meet an individual who would prioritize money over all other things, the question would arise whether this individual is ethical or not, and whether this individual is doing it right or not. So those are some of the questions that we ought to answer as we go along towards this. Okay? So kindly highlight the word study of morality's effects in conduct. That's according to the book of Esto Esta. Now, another definition of ethics is that it says it's a branch of philosophy. If you can recall philosophy, guys, who can define briefly to me what is philosophy? Sabi ethics is a branch of philosophy. What is philosophy, guys? When I say philosophy, what do we mean by that? Or who can tell me what is philosophy in the shortest sense? Yes, Lawrence.
It's the study of the way of life, sir.
Okay, it's the study of the way of life. Yes, Aliyah.
Study of knowledge, reality, or experience, sir.
Okay, so philosophy is actually the study of knowledge. Diba? So when we talk about philosophy, it's not about pagiging pilosopo. Okay? It's not about pagiging pilosopo in your ways, but philosophy basically is the study of knowledge. It makes us understand how can we gain knowledge, what is reality, and what is considered to be ethical. In this case, guys, ethics is actually considered to be a branch of words class. Ethics is telling us good and what is morally bad. Take note that I use the qualifier morally because in the study of ethics, I could not tell you that something is good every time. Okay? I could not tell you that something is intrinsically good every time. Okay? Now, let's take for example, paracetamol. Are you students familiar of what paracetamol is? Guys,
Yes, sir.
familiar ba tayo kung ano yung paracetamol? Sige, can somebody tell me what's the use of paracetamol? Sige na, can somebody tell me what's the use of paracetamol? Oh, yung mga yes sir dyan. Okay? Yes. On chat, even on chat, you can do it. Yes, Denise. How do you pronounce your name? Go ahead.
Denise, sir.
Okay.
Paracetamol
Yes,
is used
Ina
to
na lang. I
treat,
will call you Ina. Yes, Ina.
paracetamol is used to treat ang fever, sir.
Okay, paracetamol is used to treat fever. And then others are saying, sir, it's a pain reliever. That's also correct. And others are saying that it's for headache. Okay, somebody said it's for headache. Now, all of your answers are actually correct. Now, all of your answers are actually correct. But the thing is, class, is paracetamol good all the time? Na? The fact that I'm asking that question simply gives you an idea that paracetamol is not considered good all the time. Kasi pagpapakinggan mo, di ba? Sabi ni Diana, sir, it's used for headache. Yes, that is true. That is true. When we're talking about paracetamol, paracetamol is actually used for headache. Now, others would say, sir, it's used for fever. That's actually true. So, class, pag sinabi natin that paracetamol is used for pain, that would mean that paracetamol is an analgesic. If paracetamol, class, is used for fever, that would mean that paracetamol is an antipyretic. Okay? Class, pag sinabi kong pyretic, pag sinabi kong pyrexia, pyrexia, class, stands for fever. The medical term for fever is pyrexia. That's why the medication that can combat fever is antipyretic. Now, going back, di ba? It sounds good. Tingnan mo, it can cure pain, it can relieve, pain, it can relieve fever. O, di ba? Parang ang galing niya. But take note, if your patient would have overdosage of paracetamol, your patient may have a problem with your liver. Your patient may experience liver failure. Okay? And that is where ethics would come in your pharmacology classes, because we are concerned on what is right or wrong, and it could include the concepts of virtue, vice, duty, and obligation. Okay? Now, let's say for example, ngayon, nalaman nyo in our discussion that paracetamol can cause liver damage. You know that paracetamol can cause liver damage. As a nurse, it is actually your duty to administer medications. Tama, di ba? Turo sa atin sa fundamentals of nursing, responsibility ng nurse na mag-administer ng medications. Is that correct? Is it part of your responsibility to administer medications? Is it part of our nursing responsibility to administer medications? Yes, ha? Sa mga nagdadalawang isip, yung pag-order ng medications, nasa doktor yon. Pero yung pag-administer ng medications, nasa atin yon bilang nurses. Now, let's say, for example, you know that the patient has liver damage. Nakita mo na siya, the patient came into you and this patient has a liver problem. Okay? Then the doctor ordered to give paracetamol, 1 gram. As a nurse, what do you think is the wise thing to do? Will you proceed with the administration of paracetamol, or will you first clarify with the doctor?
Clarify.
Clarify,
In that case, class, in that case, you know that you need to clarify with the doctor. Okay? So as you can see, that's the beauty of ethics, because you are concerned with the judgment about what is right or wrong. And you are concerned of your duty and your obligation. It is true that it is your duty to administer medications. Walang duda yan, guys. It's our duty to administer medications. But take note that above that duty, it is also your duty to protect your patient. It is also your duty to protect the patient. And how can you protect the patient? Not all medications, guys, can protect the patients. Okay? Not all medications can actually protect your patients. There are medications that may be detrimental to your patients, just like the case here that I have given to you. Are you getting the point? Okay? So that's why when I say ethics, guys, you use your judgment about what is right or wrong. Another example, familiar of abortion? Are you familiar of abortion?
Yes, sir.
Yes,
sir.
Sure, wala kami nakabati. Okay, so abortion, right? Abortion, guys, is becoming very common. No? When I say very common, for example, when I was going to school, when I was still learning nursing, maybe I can hear of 1 case of abortion every year or every month. No? But right now, it's very rampant. It comes to a point that in the social media, almost every other day, you will be able to see cases of abortion posted in the social media. So it's becoming very common. Now, plus, when we talk about abortion, later on, you will see that there are different types of abortion. Okay? May abortion naman class na sinadya, may abortion naman class na hindi sinadya. Okay? So don't think na, hala, abortion, bad. Okay? There are cases of abortion wherein it's medical. Okay? It was not intended, but then it eventually happened. And there are cases of abortion naman na sinadya talaga. In other words, they went to, anong tawag natin dyan? Paltera? Di ba may term tayo na paltera? Okay? Or they went to somebody under the table and then they had this abortion. Okay? So class, in the practice of nursing, do we allow induced abortion? Pag sinabi ko class na induced abortion, ibig sabihin I gave you a medicine or maybe I did some instrumentation. For example, I inserted something through the vagina going towards the uterus to get the product of conception. That is induced abortion. Now, going back to my question, in the practice of nursing or even in the practice of medicine, do we allow this? Do we allow induced abortion?
No, sir.
No. Huh? No. Okay? No. Here in the Philippines, it's a no, no. Not allowed. Okay? Not allowed. Code of ethics tells us no. Legalities tells us no. Now, come to think of this. Let's say, for example, an 18-year-old female came to your hospital. She is massively bleeding after going to somewhere, okay, after the induced abortion. What would you do? Will you entertain this patient or not? Sige ha. Ganito yan, class. Pumunta siya sa inyo after niyang magpa-abort. So, kumbaga, sasabihan kanya, nurse, grabe yung bleeding ko. I feel so bad about the bleeding process here. I'm feeling weak about the bleeding. And she confessed to you, nurse, nagpa-abort ako actually kahapon. Will you accommodate this patient in the hospital?
Yes.
Yes, sir.
Okay? So earlier, somebody answered yes, entertain siya natin, and you affirmed that. So guys, yes. Okay? Yes. Although we say that we do not allow abortion, when they will come to us and they are asking for help, okay, we need to accommodate them in those cases. Pero how about if, let's say for example, si Marikit Maganda pumunta sa'yo sa hospital, tapos sinabi, nurse, nag one night stand kami, and tomorrow, pagkagising ko, nurse, I knew that I am pregnant. I want an abortion. In the Philippine setting, will I accommodate her?
No, sir.
No, sir.
In that case, hindi. Okay? In that case, hindi. Okay? I am not sure if what will happen a year or two or maybe 5 years from now when the changes in laws will come into place. But then as of this time, class, we are not allowing abortion. We are not allowing induced abortion. Okay? That's one thing that you need to understand. So kita nyo guys, dyan nyo nakikita yung the use of judgment about what is right or wrong. Okay? Hindi porket nagpa-abort siya, you will say, ay okay, nagpa-abort siya. Sala yan na iya. Sala yan, nagpa-abort siya. Ti pabayida siya kung magdinugo siya. No, that's not how we think as nurses. Because remember, it is for the common good of our patient. That's what we are thinking of. Now, another thing, for example, there are religion who are very strict now. There are religion, or let's say, for example, the traditional Catholic. Okay, I'm not saying traditional in the bad sense, but I know that there are Catholics, for example, who would not allow for surgical sterilization. Familiar kayo ng BTL? Are you familiar already with the BTL? The bilateral tubal ligation. Have you heard of that? I will type it in the chat box.
Yes,
Let me see.
sir.
Bilateral tubal ligation. Okay? Yan ba class yung sinasabi nila na magpalaygate? Di ba? Na sinasabi nila na magpalaygate. Okay? Or others would say, for the male, you have vasectomy. So class, if you will be doing this, the BTL and then the vasectomy, meaning class parang permanent na that you will not be able to give birth since the fallopian tube is cut and the vas deferens is cut. So there are religions that would not allow this. So if you are the nurse, for example, okay, let's say a patient would want to undergo bilateral tubal ligation. Tapos ikaw na nurse, sa religion mo, hindi nyo supported, very strict kayo na ayaw nyo ng BPL. What would you do as a nurse? A, will you still assist in the procedure? B, talk to the patient to cancel the procedure? Or C, will you request somebody to assist in the procedure? What do you think is the best thing to be done?
C, sir.
Yes, others?
Caesar.
Okay. So class, kita niya, that is also ethics. Okay? That is also ethics. Ethics is not only protecting your patients, it's also protecting us as healthcare professionals. So halimbawa, kung ayaw talaga namin ng ligation sa religion namin, bakit ko ipipilit, guys? 'Di ba? Kapag labag sa kalooban ko na ikakat ni doc ang tube na yan, pagkatapos hindi na makakapag-conceive, hindi na makakapag-give birth ang aking pasyente, it's against my will. You can actually tell your head nurse, ma'am, can you have another nurse assist? Are you getting the point? Okay? So it's not only protecting your patient, it's also protecting you. And that is what we are going to continuously learn towards this course. And you will encounter the term naman, bioethics. So pag sinabi naman nating bioethics, okay? Pag sinabi nating bioethics, it is a living study of the conduct of human life. Basically, class, it's the study of morality applied in human life. Okay, just put it like that. It's the study of morals applied in human life. That's why it's referred to as bioethics. And your bioethics is the study of ethical moral implications. One of the keywords there is new biological discoveries and advances. Okay? New biological discoveries and advances. Bakit po natin kailangang pag-aralan ang new biological discoveries and advances? One of the things there that might have already gained your attention is what we refer to as genetics. Okay? And with genetics, papasok ang issue ng cloning. Okay? You're familiar with clones, right? You've heard of clones already, right? Okay? And the ethical question comes there, is it okay to clone another human being? Okay lang ba, class, na ako, na si Helbert John Porque, mag-clone ako ng isa pa, okay, at magasik ng lagim sa world? Okay lang ba, nagagawa ako ng another one like me? Okay, is it ethical to have another one like me? Okay, so that's the question of cloning. And other than that, class, we have a lot of advancement already in technology. So for example, you have your cryo or preservation. You already have your cryo technologies. If you can recall the story of the late President Marcos, the late Ferdinand Marcos, di ba, class, he was frozen with the hope of the family that someday he can be reincarnated, no? If the technology will already be available. Kung kaya nga yung katawan ni President Marcos, the late President Marcos, was placed on cryogenics. Right? Now, so there are questions like that. Is it okay to preserve the human body upon death in such a way that later on, he might come back to life? Diba? And there are technologies, for example, such as your ECMO. So class, you have your ECMO. This is an advanced machine that is being used right now in operation. Plus, your ECMO would act as your temporary lungs. Your ECMO would act as your temporary lungs. Your ECMO stands for extracorporeal membrane oxygenation. Okay? Your ECMO stands for extracorporeal membrane oxygenation. Okay, wait lang, try nating i-type. You kindly take note of it so that when you will encounter it later on, you will already have an idea. Oxygenation. Okay, extracorporeal membrane oxygenation. So class, siya yung nagiging temporary lung ng patient. In the past, when the lung is not functioning, patient is dead. Patient will rest in peace. Right now, if the patient is not functioning, if the lungs is not functioning, if the patient has the money, you can attach the patient to the ECMO machine and that will act as the temporary lungs of the patient. until a suitable lung will be available for donor. That's why that's where the issues in bioethics would come in. Okay? Nakikita nyo sa mga movies, hindi, sa mga Pinoy drama nyo to nakikita siguro. Wherein class nga naka-attach siya sa machine, pagkatapos ang issue is who will pull out the plug. 'Di ba? Have you seen that? Na yung
Sir, yun
issue
po
is
ba yung life support, sir?
yes, correct. That will be the life support, no? That will be the life support. So, 'di ba? 'Di ba yung mga drama kadalasan is nasa life support siya, tapos sino yung magpa-plug out. So those will be answered by bioethics. Okay? So kung kaya baka magtaka kayo, sir, bakit bio human life pero focus tayo sa new biological discoveries and advances? With the new biological discoveries kasi class and advances, mas napaparami yung issues natin in healthcare. Kumbaga, dati, pagpatay, patay siya. Okay? Pero ngayon, class, pagpatay, parang marami pang question. Okay? Talaga bang patay na nga ba siya? And even, class, the definition of death, we are redefining death because of the advances in technology. Okay? Another term that you will encounter is health ethics. And when I talk about health ethics class, it deals with the study of the concepts of principles of ethics applied to individual, to schools, hospital, community, and society. Okay? You don't need to memorize that. Just think of it. Just this is what you need to memorize. Who are the clientele of the nurse? So class, the client of the nurse are individual, family, groups, and community. These are the well patient, the family, the groups, and the community. And when we talk about health ethics, it's the application of ethical principles towards any of these groups and the issues in the healthcare system. Okay, and the issues in the healthcare system. Class, if I will ask you this obvious question, sino ba sa inyo, class, ang may gusto that everybody would have medications and medical needs by the time that they need it? Who would want that situation? That everybody would have medicines, would have surgery by the time that they need it. Would you want that? Diba? It's a very favorable situation. Okay? It's a very favorable situation. But I can tell you guys that that is not possible to be done. Okay? Hindi po posible that everybody will have medications, everybody will have surgery at the same time because of the limited resources that we have. And one thing that we need to acknowledge is that we have a problem on the Philippine healthcare system. Okay? I don't know who among you have recent patients in the hospital setting. Sino sa inyo yung recently or maybe past 6 months may mga patients sa hospital setting? Have you heard na, sir, ma'am, sorry, wala kaming rooms? Have you heard of concerns like that? Diba? The hospitals will tell you, ma'am, sir, sorry, we would want to admit your patient or your patient is ideally for admission. However, there is no room available in the hospital. But you know what, class? What's the problem is common among the hospitals here in our locality. The room is actually there. The physical room is actually there. But there are no nurses to handle the patient. There are no nurses to handle the patient. And that is where, again, ethics will come in. Okay? That's why, class, later on, you will know that we have principles such as triage. Okay? That's letter T. We have principles such as triage, which we use to prioritize the patient. Ibig sabihin, halimbawa, all of the patients will come in the ER. Not all of them will be served at the same time. Okay? Hindi pwede na lahat sila papasok and i-entertain ko at the same time because I have triage that I need to follow. Meaning, I would prioritize those with life-threatening conditions. Okay? When they are in the ER. So, parang ganon, because we have issues in the healthcare system. So later on, you will touch on the different principles also of ethics na, that we will be able to guide you in making the decision on that. And you have the term professional ethics. So as the term implies professional, ibig sabihin, class, it's on the conduct of behavior and practice when you are carrying out professional work. In our case here, you are considered to be a professional if you have a license issued by the Professional Regulatory Commission or the PRC. That's our regulatory body for the profession. So in my case, for example, I'm a nurse. I need to renew my license every 3 years. No? As a teacher, I also need to renew my license every 3 years with the PRC. So as the doctors also need to renew their license. But anyway, when I talk about professional ethics, it is concerned with the conduct of a professional. So class, dyan yan nakapasok that we should be dressed appropriately when we are in our job, when we are in our formal events, when we are in government offices. For example, as a nurse, no, I cannot go to PRC wearing shorts, wearing sando, because I would renew my license. That would be against our professional standards. Also, as a nurse, for example, halimbawa, class, may asawa na ako. Pagkatapos, I will have lived in with another nurse, for example. Unethical yon. Okay, it's unethical. Other than bawal siya on the Family Code of the Philippines to have the live-in partner if you are already married, it's also unethical on the part of the nurse because it's against the Code of Ethics. Okay? Mas mataas kasi class, if you would look at the moral transcendence, they refer to that as moral transcendence. They say that the moral transcendence of nursing, okay, and educators, so teachers and nurses, are higher compared to other professionals. So, kumbaga class, parang pangit naman na example. Pero if, I will not name a professional lang. So for example, if another profession would commit adultery compared to a nurse committing adultery, mas malaki yung pagkakasala ng isang nurse compared doon sa another profession who committed adultery. Because nurses are supposed to be, and nurses are expected to protect the sanctity of life and then that of the family. So kung kapag nurse ka, tapos ikaw pa yung nagkaka-live-in partner, winawasak mo, sinisira mo yung ibang pamilya, what kind of nurse are you? Parang ganun. Are you getting my point? Huh? So mas mataas ang moral transcendence ng educators at saka educators, nurses, compared to other professions. Okay? In our case as nurses, so you have your code of ethics. So our code of ethics is enshrined. It is written in Board of Nursing Resolution number 220, series of 2004. Okay? Sir, kailangan pa bang i-memorize? Oo guys, dala na siya sa mga dapat natin memorize on. Okay? The Code of Ethics for Nurses is enshrined in Board of Nursing Resolution number 220, series of 2004. Plus, that the same Code of Ethics was made as an answer to RA 9173. Your RA 9173 is the Philippine Nursing Act of 2002. This is the current law of nursing. And because of that law, we made your Board of Nursing, the Board of Nurses made your Board of Nursing Resolution number 220. It is the Code of Ethics for Nurses. So dyan nakalagay kung ano yung expectation sa isang nurse when it comes to individual, to the co-workers, to the society, to the community. Okay? So that is all embodied in your Board of Nursing Resolution series of 220. Okay? Now, this definition of biology, sorry it came late. It's supposed to be before the definition of bioethics. But I just would like to remind you that when I say biology, it's about the study of life. So it's about the natural sciences, living organisms, and how we interact with one another. So that's why when we talk about bioethics, it's ethics applied to life. It's ethics applied to human life and any other things that has life. Okay? Sir, bakit? May pakialam pa ba tayo sa ibang may buhay? Yes, guys, animals we have. If you are conducting animal studies, we need to comply with the ethical guidelines for animal studies. Okay? You can't just go around and tsaka, sir, I will just cut a rat and then inject an experimental drug to that rat, to that mouse or mice. Hindi pwede. Okay? You have already your rights, your animal rights advocate for these animals. It needs to undergo ethical approval. So that's why when I talk about bioethics, other than human life, it also deals with animal life and even plant life. Anything that has life is covered by bioethics. And along the way, you might have heard me already mention morality because I defined earlier that ethics is a study of morality. And class, when we talk about morality, it refers to the social convention about right and wrong human conduct that are so widely shared. In other words, class, your morality is grounded on norms. Okay, your morality is grounded on norms. Okay, have you heard of cannibals? Have you heard of cannibals? Familiar
Yes,
ba kayo
sir.
ng term na cannibals?
Yes.
Okay,
Yes, sir.
what's one characteristic of cannibals, class?
Ginakaon to sir ang same species do.
Okay, yes, they eat the same species. So in other words, cannibals would eat other humans also. And that is morally acceptable to them. But if I will go right now and then eat you, will that be morally acceptable? Hindi. Di ba? Because our civilization tells us that it's not. So morality is actually defined by the norms or the social convention. Okay? So whatever that convention that is shared or socially approved norms of human conduct. Right? So those are some terms that you need to remember as of now, and those are some terms that you need to review now so that you will be able to familiarize yourselves with the principles of ethics and the background on ethics. Okay, so dear students, I would like to go back to the definition of ethics just as a recapitulation. So when I talk about ethics, guys, ethics basically is a generic term, okay, for various ways of understanding and examining the moral life of a person. And I would want you to go back to the keyword moral life of the person, because basically our goal here in ethics is to understand the morality. Again, our goal here in ethics is to understand morality. Okay? And when we talk about ethics, it's the study of morality's effect on the conduct of the individual. So when I say conduct, that would already pertain to the specific behavior, to the specific action of the individual, may that be your patient or another nurse. So kumbaga, ang focus natin sa ethics is i-understand natin kung ano yung morals ng isang tao so that we will be able to understand kung ano ang effect nun sa action niya. Okay, that is our role and goal in ethics. Now, class, when we talk about ethics, there are different approaches to ethics. Pag sinabi kong approaches to ethics, how do we deal with the individual patients or how do we deal with the individual problems related to ethics? So on the list, there is that you have normative, you have descriptive, and you have analytic. Kindly take note of this. You have normative, you have descriptive, and then you have analytic. Now, do not memorize the definition, but try to internalize it from the word itself. Let's say, for example, normative. Pag sinabi ko class na normative, okay, it is based on the society's standards. It is based on the society's standards. And when I say class standards of the society, we commonly refer to that as norms. Diba class, pag sinabi nating standards of the society, norms. Kung sa atin pa in Tagalog, yung mga nakasanayan, mga nakagawian, and the usual things that we are doing in our community, okay, in our culture, in our society. So when I say approach to ethics that is normative, when I say approach to ethics that is normative, that would mean that I would say what is good, what is bad, depending on what we usually do and what we usually encounter in our community. Okay? In other words, tinitingnan natin, acceptable nga ba to sa culture natin? A very good example perhaps is eye contact. In our case, di ba, pag nag-eye contact tayo, that's an indication that you are listening to me, I am listening to you, I am committed to the conversation that we are having. But if you are dealing with other organizations or other culture, okay, let's say, for example, Japanese people. Japanese people may find it offensive. They might find it aggressive if you are continuously maintaining eye contact. Okay? Baka titingnan nila, ay, parang napaka-aggressive naman ito. Bakit tuloy-tuloy talaga yung eye contact nito? Okay, so for that reason, we need to consider the norms. That's why one approach in research, or one approach in ethics, is normative. Okay? One approach in ethics is what you refer to as normative. Now, second, you have your descriptive. So when I talk about descriptive class, as in the term describe, okay, descriptive or describe, this is based on what people believe and how they are phenomenologically described. Okay? Now, look at the word phenomenologically described. If you can recall, class, your discussion way back to your, anong tawag natin dyan, research, no? Since you have your research in your senior high school years, so if you would look at your discussion in research, among the things that were mentioned in your research classes is phenomenology. Okay, di ba class na mention yung word na phenomenology? So when I say, dear students, phenomenology, kindly write it down. That when I say phenomenology, it talks about the lived experiences. Okay, isulat ninyo class, pag sinabi kong phenomenology, it talks about the lived experiences of the individual. So ano pong ibig kong sabihin? When I say that the approach to the research is descriptive or approach to ethics is descriptive, it would depend on the description of the individual, whether this experience is pleasurable, whether this experience is tolerable by the culture, whether this experience is acceptable. Okay? In other words, halimbawa, kakausapin kita, no? Halimbawa, we are dealing with a cancer patient at the end of life care. Pagkatapos, this patient had a DNR. Are you familiar, class, of what is DNR?
Yes, sir.
Okay, so are you familiar, class, no? DNR, what does DNR mean? Can anybody tell me what is the meaning of DNR?
Do not resuscitate.
Okay, so do not resuscitate. So class, pag nakita natin that this patient is do not resuscitate, kadalasan class, iba-iba kasi yung opinion dyan eh. Yung iba magsasabi na, ay sayang, life is sayang. Kasi malakas pa naman sana yung possibility that he will be able to survive the condition. Whereas others will say na, sige, ipa-DNR mo na kasi the patient is about to die naman. So it's about time for the patient to have DNR. Now, if I will use the descriptive approach to ethics, it would actually depend on the experiences of the individuals going to DNR. Halimbawa, if I talk to the patient and then the patient would say, nurse, I would really want to have DNR because I'm already fulfilled with my life and then I don't want to suffer anymore with the machines that will be attached to me. Right there and then, I will be able to realize na, ay, okay, yung purpose niya pala for having the DNR is that he has already accepted his fate and he is already fulfilled with his life. Okay, so that is based on the description of the patient. Description niya yon. Iba din siguro yung description ko bilang nurse, iba din siguro ang description mo bilang family member. Pero yun yung description ng patient natin. Okay, so that's the descriptive approach. And when I talk about analytic approach, analytic is based on the analysis of concepts. Your keyword there is analysis of concepts and methods in light of what they observe, believe, and practice. Okay? So, allow me to give an example. Halimbawa, in the US, there are a lot of machines that are being invented. There are a lot of medical advancements that are arising already. But not all of this, again, not all of these medical advancement can be applied here in the Philippine setting. Using the analytic approach, I need to think, is the machine available here in the Philippines? Second, if the machine is even available, will the Filipino people be able to afford the machine? And third, will they be using this machine? Are there physicians here who are credible, who are trained, in the use of this machine? So, di ba, halimbawa, maririnig natin, uy, sa US, ito yung bagong update. Ito yung magandang update when we talk about US machines. Okay? However, when it comes to a point that these machines will be brought already here in our setting, hindi naman natin class masisigurado that these machines will be applicable here in our setting. Okay? So, yan yung mga dapat nating tandaan. So, when I talk about these different approaches of ethics, don't think kung saan dyan ang tama or saan dyan ang mali. Because it would actually depend on the situation that you are encountering. Okay? Halimbawa, in our case here in the Philippines, there are instances that you need to decide based on the culture. Okay? A very good example perhaps is in the hospital setting, guys, usually nililimit natin yung visitors. So if you would go to other countries, let's say for example, you will go to Singapore, you will go to that of the United Kingdom, you will go to the US of A, you will not notice that there are a lot of family members in the hospital. Okay? Kadalasan kasi yung pumupunta sa hospital, isa lang. As in the nearest of kin, kung sino man yung responsible sa patient. So halimbawa, kapag bata yung na-admit, mother lang yung nakikita sa hospital. Or halimbawa, kapag isang adult yung na-admit, baka boyfriend niya or baka immediate family member niya yung makikita niyo sa hospital. Okay? That's how it worked in first world countries. But look at it here in the Philippines. Okay? You would notice that there are a lot of family members who are visiting our patients here. Okay? Napakaraming family members ang nag-visit ng patients natin. And the question sometimes is, do we allow these people to visit? Do we allow these people to visit their family members? So class, basically, we can allow them. And in fact, here in the Filipino setting, we encourage it because it has been observed that it facilitates the recovery of the individual patients and individual family members. Alam nyo, class, iba kasi yung feeling ng isang Pilipinong pasyente na makikita niya yung mga pamilya niya, class, na nagbibisita. Kaya iba kasi yung feeling niya, class, kapag nakikita niya, uy, marami akong bisita. Uy, maraming nagke-care sa akin. So, normative standards would say, okay, we welcome visitors for the Philippine setting. But if you would look at it in the international standards, hindi. Okay? Because they would think of infection, they would think of cross-contamination, and all those other things. Okay? So again, these different approaches of ethics does not tell us which is right or wrong. It tells us that it would depend on the situation if which is more applicable. Okay? So that's it. Now, what are the different triggers for bioethical discussion? Okay? So ano yung mga kumbaga, ano yung mga possible issues na pwede nating ma-encounter in the discussion of ethics? So, isa dyan, class, is transplant. Okay? Isa dyan, class, is transplant. So, right now, okay, there are already a lot of organs that can be transplanted. It goes as simple as your skin. It goes as far as your kidney, as far as your heart, as far as your lungs. Okay? And even your liver. All of those organs could be transplanted. As far as I'm concerned, brain pa lang and spinal cord ang hindi ko pa narinig na transplant. Okay? So far, I have not heard of transplant of the brain and spinal cord. But all of the other organs, they can be transplanted. So the question of ethics there is that who will be able to receive the organ? Okay? Who will be able to receive the organ by the time that the organ is already available? Plus, in countries like that of the US of A, the United States, class, and then other first world countries, they have already established a very good, what do you call this? Organ donation system in such a way that if somebody in the locality would die, and then that somebody has a very good heart, has a very good lung, automatically, class, the organ donor registry would be visited. Kumbaga, class, may listahan na sila if who needs what organ. Okay, they will have that listing if who needs what organ. And for example, may accident, tapos yung heart niya okay pa. Right away, class, the heart will be harvested and that heart will be brought to the patient who needs it. Okay, may that be via helicopter, via airplane. Usually they are using helicopter because it would be faster. Okay, it would be faster compared to that of your plane. Okay, so may mga ganon. However, in the Philippine setting, kaya nga sinasabi ng ibang critics na in the Philippine setting daw, sayang yung mga organs because the organ donation system is not yet widely established. Okay? So there are a lot of organs wherein it could be used sana. However, class, is that it's not widely used. No? It's not widely practiced here in the Philippine setting. Now, another thing is cloning. Have you heard of cloning? Can I get a heart react for those who heard cloning? Have you heard of cloning already, guys? Hindi pa. Okay? So class, clone, as in the duplication of another individual or another animal. Now, in that case, class, if I'm not mistaken, on the picture on the right, I think that's the first clone, Dolly. Okay, Dolly the ship. the first clone class was Dolly, the ship. Okay? So class, when cloning was done, basically the goal of cloning is to duplicate a certain individual, okay, to duplicate a certain animal. And the question comes in naman, can we duplicate people, or can we duplicate individual people for that matter? And of course, as of this time, the consensus of geneticists is that it would not be wise to do it because it will disturb the genetic pool. Okay, so this is where some of the genetics expert would put a limit to what they do. Okay, imagine, no, halimbawa, ikaw Eunice or ikaw Kyle, if cloning will be allowed, maybe later on in the future, Kyle can be able to say, okay, gusto ko there will be another me in the next generation. And then you will just donate some amount of blood and then they will be able to duplicate or replicate your cells. Okay? But as of this time, the question there remains, is it us, humans, who have the power to do it? Or is it supposed to be gods now who can create us? So that's where the ethical debate comes in. Next, donor harvesting. Doon naman class sa donor harvesting, I don't know, are you watching medical series such as Grey's Anatomy? Nanonood ba kayo ng mga ganon? Who among you watch Grey's Anatomy? Okay, wala. Okay, I would encourage you to watch Grey's Anatomy class. It's a very good opportunity for you to think of medical issues when you are still students. Plus, yung sa donor harvesting naman, ang problema natin dyan is this. Okay? When I say donor harvesting, that's the time that the organs of the donor will be taken. Okay, that's the time that the organ of the donor will be taken. So plus the question there sets in, when is the best time to harvest the organ? Okay, when is the best time to harvest the organ? Now, let's say, for example, there's a patient in the hospital, bedridden. Nakahiga lang siya class, kumbaga, mahina na yung possibility that he will be able to improve from his condition. Okay? Now, is it okay already to get the organs of these individuals to be given to other patients? Pwede ko na nga bang kunin yung lungs niya habang buhay pa siya at saka ilipat sa ibang pasyente? Eh sir, bakit mo kukunin habang buhay siya? Eh buhay pa nga siya. Plus the argument there is that if you will harvest the organ while somebody is still breathing, the organ is very good for transplant. Okay? If you will harvest the organ while somebody is still alive, it's very good for transplant. Are you getting my point? It's better for you to get the organ habang buhay siya rather than for you to get the organ kung patay na siya. Okay? So it's better for you to have the organ nung buhay pa siya. So, but then people would argue, eh bakit kukunan mo siya ng organ, buhay pa siya? Paano kung makaka-recover na siya? Paano kung makaka-recover pa siya? Imagine class, no, kinuha mo na yung kidney ng isang tao, tapos after a day, nagising siya, wala siyang kidney. Diba? Are you getting the picture? Okay? So parang ganon. So ganon. There's the argument there. And you might be thinking, sir, how do we settle that? If you don't want to be in that position, there is a document that we refer to as advanced directives. Again, there's a document that we refer to as advanced directives. Pag sinabi ko class na advanced directives, ano pong ibig sabihin nun? In that document class, you will be able to write, okay, if what are your plans for your organs in the future. Okay, in that document class, you will be able to write if what are your plans for your organs in the future. Okay? For example, in my case, I can write a document that will say na in the future, I would want to donate my lungs and I would want to donate my ano pa nga ba dyan? I would want to donate my bone marrow, for example, and my kidneys if ever I become comatose. So right there and then, class, habang ganito pa yung state that you are able to decide, you will be able to make a decision rather than to place your family members in a situation wherein they are unable to decide for you. Okay? Are you getting my point? So para hindi kayo malagay sa situation na, okay, na alanganin kayong magdesisyon kung anong gagawin nyo sa buhay, right now you can make the decision as an informed adult, as an adult of consenting age. Okay? 18 and above, you can already decide kasi. And other than that, if you have your driver's license, by the way, please be particular and try to read the back part of your driver's license. The back part of your driver's license actually talks about organ transplant. Okay? Kindly view that if you have your driver's license. Kindly check on that. Then, the next point here for bioethical discussion is the scarce resources. Okay? A very difficult thing for us to admit is that kulang talaga yung resources natin in the healthcare setting. And a very good example of that is during the time of COVID-19 pandemic. Okay? Di ba, class, nung pandemic, maraming namamatay? Nung pandemic, maraming mga pasyente ang hindi ma-admit sa hospital. And the reason for that is the scarce resources. Pag sinabi ko, class, na scarce resources, kulang. Kulang talaga. As in, the hospital is there but there are no nurses. If there are nurses, the ventilators are missing. Okay? Or the ventilators, are lacking in the hospital setting. Kung kaya't maraming namatay during the COVID-19 pandemic. And even at the start of the pandemic, you might have noticed that even PPEs, nagkakaproblema tayo. Okay? Nagkakaproblema tayo sa mask, nagkakaproblema tayo sa gloves, nagkakaproblema sa gown. And that is because of scarce resources. Saan papasok si ethics? So class, ethics would tell you who will have the gloves first, who will have the mask first, who will have the gown first when we are facing the pandemic. So in that case, class, nakulang yung gown on the start of the pandemic, sino yung pinaprioritize? We prioritize the ER nurses. We prioritize those who are facing the patient for the first time. We prioritize, class, those who are taking the samples for the nasopharyngeal swab or the oropharyngeal swab for testing of COVID-19. And ano pong basis natin dyan? Principles of ethics. We cannot provide everything to everybody, so we need to apply the principle of utilitarianism. Pag sinabi ko, class, na utilitarianism, it means the common good of a greater number of people. You write it down. When I say utilitarianism, it means the common good of the greater number of people. Okay? Greater number of people yung tinitingnan natin, class, na magbi-benefit. Okay? So that's where ethics comes in. And then the next point there is brain death. So when can I say that somebody is actually dead? Is it by the time that the heart stops beating? Or is it by the time that the brain stops already releasing some waves? So that is where the definition of brain death would come in. Dyan, class, pumapasok ang definition ng tinatawag natin na brain death. And when I say, class, brain death, that would mean that there are no more EEG readings. There are no more EEG readings from that of your patient. Okay? So class, I'm writing it on chat. You have EEG. Okay, that is one of the diagnostic tests for brain activity. So class, when we talk about brain activity, you have actually, there are usually two tests that are usually confused of. So one class is your ECG, the another one is EEG. Class, as the term implies, pag sinabi kong ECG, electrocardiography or electrocardiogram. Pag sinabi kong EEG, electroencephalogram. Okay? So class, if you would look at the way I typed it, I capitalize cardio to indicate its heart. I capitalize encephalo to indicate it's the brain. So if I would want to detect the presence of brain activity, it will be EEG. And then if I would want to assess for the cardiac activity, that will be your ECG. Okay, so you have class ECG and EEG for that matter. So students, with those anong tawag natin, bioethical issues, I hope that you are considering the different issues that we might possibly encounter later on in our field. Now, I would leave this case to you. Okay, I would leave this case to you, and I would just ask you to have a very short answer, maybe 2 to 3 sentences. I would open that later on in the Google Classroom if you have already access. So class, this is a case of a 50-year-old female on the 30th hospital day. Ibig sabihin class, 30 days na siya sa hospital. She was admitted due to multiple vehicular accident. Okay, when I say class MVA, motor vehicular accident. Okay, class, pag sinabi kong MVA, motor vehicular accident. Okay? So class, her son, 12 years old, and the daughter, 18 years old, was able to survive the car crash. And she has been GCS 3 for 20 days. Class, pag sinabi kong GCS class is an evaluation of neurologic function. Okay, can you still recall GCS way back in your health assessment? Class, naalala nyo pa yung GCS way back in health assessment? Students? Nakalimutan. So class, pag sinabi... Okay,
Glasgow Coma Scale, sir.
okay, yes, that's your Glasgow
Glasgow.
Coma Scale. Okay, sige. You can remember, no? So Glasgow Coma Scale. So class, your GCS would be a score of 3 to 15. The highest of which is 15. And class, a score of GCS 3 would indicate that our patient here is actually already on coma. Okay? Comatose na po yung pasyente natin. So the husband is deciding whether he can sign the DNR form. Okay? As a nurse, would you agree to the decision for the DNR? And if you are the husband, will you have the DNR? And what are the possible roles of the nurses in cases like this? Okay? Plus, there is no right or wrong answer for this as of this time because this is an introductory topic for ethics. But what I would want you is try to answer the question in 2 to 3 sentences. Okay? Just try to answer all of the questions, class, all. Ibig sabihin for all of those 3 questions, kahit 3 sentences lang. I just would want to trigger you to think if what would you do for this patient class who is having this condition. Okay? And let's try to think on the succeeding meetings whether your decision would be the appropriate